from my patient vitals, it's showing me it can automatically diagram for me my vitals charts, and then of course my history and RX histories have been added. At this point, the nurse can either open the exam for the physician, or depending on your workflow, the physician can now be told via the status that it's his turn to see the patient. Before I jump in and show you the chart note on the patient, I just want to talk a little bit about the rest of the dashboard here and show you that messages are out here, as well as tasks and the appointment information for the provider. So in my messaging, you can see that Christopher Anderson has a lab notification, the Case Williamson has an RX request, and that Andy Bird has a general office message that my provider needs to take care of sometime today. There's also tasks that can be assigned. So in this case, this lab order was not started for the provider, so the provider actually needs to go in there and complete that lab order for that patient that it's attached to. So it's very simple for a provider to know and keep up with everything that he has to do within a day. The other thing is actually creating notes. So I'm going to click on the New Exam button here, and from New Exam, what you're going to see is that it launches me into Microsoft Word. Before it does that, it'll ask me, are you sure you want to start a new exam? Or if your nurse started it for you, you can say, no, I need to open the last unfinished exam because I'm not completed with it, or my nurse had started it for me. Today I'm going to say yes and start a brand new exam. From here, it's Microsoft Word driven, and I have my templates or all templates, which shows me all of my other provider templates in my practice as well. I'm going to go ahead and stick with my templates today, and my templates are built under SOAP notes. And so Dr. Earn is an ears, nose, and throat provider. So I'm going to pull up Dr. Earn's template, and then you'll see Microsoft Word. This is inserted as if it's your typical letterhead. So if you have letterhead that you use in your practice today, or templates that you use in your practice today, it's as easy as importing this information in through Word. So it is typically Word, and then what you see here are these yellow areas, which are what we call data dictionary items. Data dictionary items, or liquid links, actually pull in the patient's information, like their name, their age, their date of birth, the date of service, their sex, as well as other things like their histories. So now you're seeing her surgical history, her allergies, any medications, or if she had past medical history, you would see that information as well. Because we did vitals on her today, you're actually seeing the vitals the nurse did as well show up right into the note. So all the information that was already provided to you by your nurse is automatically input into your template. I can then do anything from dictate to typing or inserting what we call tags. So on my template area, we have categories of tags that we can insert as well. So you can insert tags by clicking on them or by voice commanding them. I'm going to talk about a couple of options here. I'm hitting my F5 key, or I could voice command it to go to my next dictation spot. But what I did is I highlighted this dictation point behind chief complaint, and at this point I have the ability to start dictating my note. So I could say that the patient is going to be presenting with right ear pain. So now I'm holding down my dictation microphone, and I will start dictating. The patient presents today with right ear pain, period. She has been taking over-the-counter medications for pain, period. Pain started 3 days ago, and the patient has been having a hard time sleeping and is in obvious pain, period. So you can see that the dictation is actually very easy to put in. I have many options that I can do, from scratching something that maybe had made a mistake, or I can build a scratch program in by hitting one of the buttons on my microphone. So I'm hitting my scratch button on my microphone and it took away my last sentence. I could also have it take away my last word. I can also say underline or bold. So I'm going to say bold obvious pain. And it automatically bolded my obvious pain for me. So I can, by voice commanding anything from adding my tags to voice commanding inside my chart note, is very easy for me to use my system. I can then go from dictation point to dictation point and talk about the examination. The left ear is impacted with earwax. So you can see how easy it is for a provider to be able to pre-build his templates to look and be used just like he does today. So doing documentation via Microsoft Word inside of GloStream's EMR product is really easy for the physicians to maneuver through. I also have the ability to create multiple things, like I can add in pictures or diagrams. So I'm going to go down to my all templates and maybe borrow a diagram from another one of my providers. So I could have this built in as one of my diagrams, or I can grab another provider's diagram. I think for the moment I'm just going to grab this cyst on the back of the wrist and insert it into my template. At this point, I can double click on it and draw, so I can draw or write or do anything that I want onto this and hit insert, and it moves it into my document, into my chart note exactly. But this patient really isn't here for a cyst on the wrist, so I would rather use one of my tags that I have, which I have an ear tube tag. So I'm going to double click on this ear tubes tag, or I could voice command it. But I'm going to click on that and it'll insert any type of diagram that I want. Again, I can draw or put any information that I want on my diagram, and it becomes part of my chart note for today. So it's very simple to insert drawings or flow sheets or guidelines, any other information that I want. I can actually take a snapshot picture and insert that as well. So the use and friendliness of Microsoft Word, as well as our voice commanding process, is really a huge win for our providers to be able to get their notes done in a timely manner and be able to complete that information. I can then insert or grab my diagnoses through what we call smart diagnosis or smart treatments, smart orders, or standard diagnosis and CPT coding. Today I'm going to show you how our smart diagnosis options work. By clicking on Smart Diagnosis, I can then say this patient is coming in because of acute otitis media. Because I build my own smart diagnoses, I can say when we see patients that have otitis media, sometimes we do a tympan, and so on this patient I'm going to do a tympan, and I'm also going to remove the impacted ears. I can then say this patient's going to definitely need some amoxicillin, and I'm going to keep her on children's Tylenol for pain. I have patient education that I can check off as well, so I can actually teach them about otitis media as well as set them up for a discussion for possibly adding tubes into the patient, and they can take that education information home with them. I have the ability to do tags, and so a few minutes ago I showed you that I inserted the ear tubes tag, and I could certainly have done that through Smart Diagnosis as well. I'm going to go ahead and check this ear infection tag so that you can see that it can automatically be input into my chart note as well by using Smart Diagnosis. When I click Save and Close here, this is pretty exciting, so pay attention. When I hit Save and Close, what happens is it's going to automatically document my diagnosis and my procedures, which does send it into the billing program, by the way, and it will automatically start to write my prescriptions. It will print my education slips, and it'll insert my tags. So watch. I hit Save and Close, and that was my first patient education sheet, and here's my second patient education sheet. So now I could just hit Print, and that would print off to my default printer or at my checkout office's printer. And then I can save and close it. Once I save and close, it's throwing me into the medication module, and look, it's writing my amoxicillin and my Tylenol children's prescription. I have the ability to set up my own frequency and duration or my own SIGs for any type of prescriptions that I do on a regular basis, which I would probably do, so it would save me time. And then all I have to do is hit Send RX and Save and Close, and those prescriptions are written. Once I hit Save and Close, it put me back into my note so that I can finish doing my note, but what you'll see at the bottom is that it inserted via liquid links my diagnosis as well as part of my plan. What am I doing for them today? And then I have a paragraph that was inserted, which is really my